Most patients who are using daily prescription opioids or heroin, they have to use those substances every day, because if they don't use it for 12 hours, they start developing very uncomfortable withdrawal symptoms. Those withdrawal symptoms would usually last for about 5 to 6 days.
Withdrawal symptoms often puts people into the place where they can't make decisions on their own, and the drug kind of overrides their thinking, and that's when they go use. Because it's painful to go through withdrawal, especially if you've been on an opioid for a really long time.
So when we see patients who are detoxified, they go to a residential program where they don't have access to substances. They have 2 to 3 weeks, sometimes 4 weeks of treatment. When they return home, that's when the brain changes that still persist. 4 weeks of abstinence is not enough to reverse some of those changes. Suddenly, all those learned responses will become reactivated. Patients start having urges and cravings, and they are at very high risk of relapse and overdose. So it's a trying time for the patient to abstain from opiates, but it can be with the help of medications. Many patients are able to go through this process.
I think a lot of what we do as providers is to provide some of that support and say that you can do this. But having close monitoring, having social support, having structure is very important, because you do need to have loved ones and, a network around you to help, reinforce, the difficulty of this, because it's going to be stressful to not have what you've been so dependent and reliant on for so much of your life available to you anymore. I think historically, people were coming in and out of programs and they didn't have anything to kind of help them with their cravings. Now there's something that can actually help them with that, and that's really what medication-assisted treatment is. Buprenorphine can stop them from withdrawing, can stop them from craving. Vivitrol can prevent them from relapsing. So there are now things out there, there are drugs out there that can help people stay in recovery and stay abstinent.